All right. I'm still hearing a couple more beats, so hopefully if I talk kind of slowly and drag out the intro, it'll give some last-minute joiners some spare time to get joined in, and the beeps won't be too distracting. Couple of things. Michelle, if you're on, will you just confirm that you can see my PowerPoint?
I can see your PowerPoint.
Awesome.
Thank you.
Awesome. Thank you. All right. Well, hi, everybody. My name is Shanelle Van Dyke. For those of you who do not know me, I am a consultant for quality reporting services, and I actually work with Michelle Hoffman in the state of Wyoming on the FLEX grant. And the purpose of today's call is ED transfer, primarily the ED transfer 6 measure. But before we dive into today's agenda and everything like that, there's a few housekeeping items I just wanted to go over. This call, for instance, is going to be recorded, and both the audio and webinar portion are going to be recorded and available. We will get an email notification out once those links are available so that you guys can access it and or share it. One thing that was brought to my attention, it kind of goes hand in hand, is that this is a three-state webinar. So we got Illinois, California, and Wyoming on board. As I mentioned, this is a training call for ED transfer, the ED transfer measure 6. It is one measure in a set of all the ED transfer communication measures. As most of you are aware, all the ED transfer measures were designed for CHs and are collected only by them. The ED transfer communication is part of a broader CH initiative called MBQIP, for those of you who are not aware, and MBQIP stands for Medicare Beneficiary Quality Improvement Project. We are not going to spend any time talking about ED transfer as a whole or MBQIP as a whole. This is just ED transfer 6, the nurse-generated information. Let's see here. Since we are just focusing on making improvements to ED measure 6 and process improvement in general, that we're going to have several webinar series. So this one, for example, is for ED transfer 6. Then we're going to have another one on ED transfer 4, ED transfer 5, and so forth. However, if you are not reporting any of these measures or data and would like additional information about ED transfer communication and MBQIP, I would encourage you to please follow up with Michelle Hoffman in Wyoming, Angie Charlotte in Illinois, and Jennifer Brooks in California. Their contact information will be emailed to everyone after the webinar. So I just wanted to provide some clarification. We have quite a few of attendees on today's call, so I just wanted to make sure I clarified what the intent and purpose of today's call was. So kind of back to what I was mentioning earlier about this being a three-state webinar series, just to give you some background, and Michelle or Angie or Jennifer or Rochelle, feel free to chime in, but just really quick, this was, and as I mentioned, FLEX and MBQIP is done in Wyoming, Illinois, and California. These three states got together and decided to do a webinar series where each state was represented assisting with one of the MBQIP topics. For example, we're doing ED transfer 6. The state of Wyoming is focusing on ED transfer communication in general. And then we have, and I'm going to mess this up, I think it's Illinois, who is doing the OP27, which is the Healthcare Influenza Personnel Vaccination Measure, and the Immunization 2 measures. And I believe that's going to be on May 24th. And then again, as I also mentioned, there's going to be upcoming webinars on ED transfer 4 and ED transfer 5. And then I believe there was one other topic, and it's escaping me right now. But again, Rochelle Spinarski is sending out save the dates for these along with the login information. So feel free to call in and join all of them or any ones that you feel are going to be of most value to you. And I think that covers the housekeeping items. Again, I like to keep it very informal, so I am going to try and not have to mute the lines because I would like to not have any technical difficulties when unmuting the lines for people to talk and ask questions or just interact. I want this to be informal, and I want us to be able to have some discussion with each other. So I'm going to leave the lines off mute. So just keep that in mind because it is going to be recorded. So try to eliminate any background noise. If you do have a mute button on your phone, please use it. If not, I can mute it if it becomes too distracting. So with that being said, we're going to get started. Let me just bring up. Aha, there we go. All right. So as I mentioned, today's focus is the ED transfer communication measure 6, which is the nurse-generated information. And for the purpose of today's call, I'm just going to kind of give you an agenda layout. We're going to go over the measure itself and what it consists of. We're going to go over some data results, and hopefully I can get some discussion among you critical access hospitals. I would like to get some feedback and some input from you on why the results are the way they are. We're going to go over the obstruction guidelines if necessary. I do know, I'm just going to kind of leave it open when we get to this section, as there doesn't seem to be a lot of abstraction questions. However, I did include like 7 or 8 slides that were the abstraction guidelines for this particular measure because I thought at least it would be a great reference if there were questions during this presentation about the abstraction guidelines, or if the consensus among the group was, hey, let's just go over those real fast. So they're in there, but we don't have to go over them. I know they're pretty straightforward, but like I said, they're there for reference, or we can go over them when it comes that time. The next thing I'm going to do is show you guys how to interpret your ED transfer communication report within the ED transfer communication tool. And then from that, I'm going to show you guys this mock first quarter 2016 report and go over the PDSA or PDCA, depending on where you went to school, the Plan, Do, Study, Check, or Study or Check Act. We're going to use the PDSA then to talk about some checklists and some transfer forms and possibly modify or talk about modifying to fit your individual needs as a critical access hospital based on your individual ED transfer communication results. And if there's time, I left this in there, we can go into more widespread improvement rather than just small little rapid cycle improvement activities, which is develop and implement an action plan if there's time. I know we have to be mindful of today only being an hour, so if not, that can be there for a reference, and if not, then in the future we can try to wiggle some more room into a future webinar so that we can, as we're wrapping up the ED transfer series, we can dive more into that widespread rather than the rapid cycle. And then I just included a couple of slides that had some additional resources that I thought you might find interesting, which is primarily about nurse communication and some care transitions type of items. So with that being said, we're going to get started. For those of you who aren't as familiar with ED transfer measure 6, I kind of just want to give you a reference to something that has been around for a while. You'll notice up on the screen there's a measure overview for the nurse-generated information for measure 6, which consists, the nurse documentation consists of, the assessment interventions, impairments, catheters, immobilizations, respiratory support, and oral limitations. Now, I don't know how many of you are aware of this, but it's kind of like an all or nothing. It reminds me of the heart failure measure discharge instructions. I know that is an inpatient core measure under CMS, and it was under MBQIP last year, and the measures underneath heart failure slowly getting retired, but the discharge instructions were the same way. It was kind of like an all or nothing. You had to meet all 6 of the components, otherwise you didn't meet the measure. So what that means is, just to give an example, like if I'm abstracting a patient, let's say Mickey Mouse, and Mickey Mouse qualifies and is eligible to receive all 6 of these criteria here, but Mickey Mouse only received 5 of 6 or 4 of 6, rather than it being a percentage of the 5 out of 6 or the 4 out of 6, it's actually a 0 out of 6. I mean, it's a 0%. So that's where it kind of gets you when we're doing the reports. And I'm actually going to give you a visual that I just kind of wanted to mention that. So these are the 6 individual measures within the ED Transfer 6 measure that we're going to be looking at. So one thing, as I mentioned earlier, about this being a 3-state webinar is we're hoping to showcase, like I said, each state is doing a different topic, but going forward, like right now for this one, because we had it accessible to us, we're kind of looking at aggregate results for Wyoming, but going forward, we're trying to network together to have a high performer from different states be able to talk and share on upcoming webinars for the other measures, so that it's a way for you to be able to network and hear what other states and other critical access hospitals are doing. So it's not just going to be focused on just Wyoming. So this one is in particular because it was our first webinar, it was the data that we had available, but for the upcoming webinars, we're going to try and showcase more than just one hospital. We're going to try and have a couple high performers from at least across the other states to share. So looking at this is the most current data. Obviously, you know, we just had a data submission deadline of first quarter, but we're, for the purpose of this and getting it out and everything like that, we are going off of fourth quarter 2015 data. So you will see on this graph, it is an aggregate of rolling quarters. And my main focus that I want you to look at here is the section in red where you can see the ED Transfer 6 nurse-generated information. And you'll see at the beginning of the project, and I noticed this actually across several states and across pretty much all the measures, when the project was first starting out with the data collection and stuff like that, the numbers were a little bit higher. And then as we became more aware of the project with education and training of the measures, the abstraction guidelines, stuff like that, it kind of dropped a little bit because obviously, you know, it was new. We were learning how to abstract the measures and report them correctly and pull them from the chart. So it kind of did drop a little bit and then it kind of leveled out. But for some reason after it did that, you will notice for the last couple of quarters, it's kind of been pretty low, the nurse-generated information. So let me see if I can give you a different slide. Here's one where it's not as busy. This is the last one we're rolling quarters. This one is just literally third quarter and fourth quarter 2015, kind of a Zoom preview. You'll notice for third quarter it was almost 65%, and then for fourth quarter it was almost 70%. And looking across the other measures, 1 through 7, you'll see that it's a little bit, obviously they've been in the 70s to 80s. So, and you'll notice all ED transfer measures is kind of course, lower than the individual measures themselves. Again, that's because it's an aggregate across the core measure, across each topic. And then their individual measures. So as I was mentioning about ED Transfer 6, you got to actually look at what is actually impacting that individual measure. So for example, with ED, you know, the ED6 measure, there are actually 6 measures that impact that overall result. And so that's kind of how those are tabled in to do the overall ED transfer measure results. This is what I wanted to actually open the lines up for. You're not on mute. This is being recorded. I just wanted to get some feedback from any critical access hospital that is on the line from whatever state. I do know that when we talked with the other states, so Illinois and California and Wyoming, when they got together and talked, the reason why we focused on ED Transfer 6, 4, and 5, and I believe ED Transfer Measure 1, I believe, is going to be in there at some point too. But the consensus across the 3 states with the flex coordinators was that these were the measures that seemed to be consistent across the 3 states that needed improvement among the critical access hospitals. So I was just kind of wondering from you, the audience, would anybody be willing to share their thoughts as to why, you know, like ED Transfer 6 is like one of the lower performing ED transfer measures, or even mention of, you know, measure 4 or 5, but does anybody have any thoughts on that, at least maybe, or want to share why they think it is that way in their facility? or a theory as to why it is that way across the 3 states, that this is consistently one of the low-performing measures? Really? All these people on and nobody wants to share?
Hi, this is Jen Locknett from Ridgecrest Regional.
Hello.
Hi. We noticed that our transfer forms, they originally were not specific enough to address all these. So we added those elements so the nurses could check off that they did send those elements. And then our next challenge was that although they marked those off, they didn't mark who they sent the record with.
Okay, so it came down to, for your facility, it came down to documentation. One, making sure that the form consisted of all of the specific individual measures underneath the nurse-generated information, and then also making sure that while they were documenting it, they were specifically stating who it was sent off to.
Right, so we had a challenge in our paperwork. There was some double charting. So we've tightened that up, and we anticipate seeing that score raise in the next couple of months.
Oh, that's great. That's wonderful. Thank you for sharing. That's good to know. Does anybody else have any comments or thoughts or questions for? Okay, well, I'm going to give you a minute to think about that because I know there's other people on here that want to share, but I'm not going to yank it out of you. One of the things that we noticed, or that was shared, similar to what was just shared, is with the implementation, or I should say the switching over or to the EHRs, some facilities were having problems generating that information in their EHR or pulling that information from their EHR. So while they were aware, or because they're a smaller facility, they knew that it was getting done. It was just a matter of proving that it was getting done or being able to generate the information out of the EHR. So one of the things that I just wanted to share is, for example, we had a facility in Wyoming. We actually had a group of facilities who all used the same EHR system, I should say. And we had a facility who was consistently submitting their ED transfer on time. Their numbers were actually really good. And we noticed that these other facilities were, using the same EHR, but not as consistent, and or could use some assistance from this, I should say, high performer, or this champion hospital, so to say. So long story short, what we were able to do, and Michelle, feel free to chime in if I'm explaining this wrong, they actually set up a webinar with this one facility, and they actually provided a little webinar training tutorial about how they used their EHR system, which was Cerner, to pull the information they needed for ED transfer, and a form that they actually used for generating or identifying certain information in the ED transfer abstraction, and then so that they could report it. So there were, I think, 3 or 4 other hospitals that were using Cerner that actually sat in on this webinar and learned from this one facility how to pull the information appropriately from their EHR and get it reported, so that one, they could find it and could get the information out of the EHR that they needed to, but then also how they could use their EHR to better collect the information to show that it was being done. Okay, does anybody have anything that they want to share as to what they're doing at their facility, or why nurse information might be one of the low-performing measures, or if it was at your facility, how you addressed it, or? Okay, so one thing I'm noticing I'm having a problem with, if I could just, let's see here, the next couple measures, as I mentioned earlier, measures, I should say slides, my bad, are actually the individual abstraction guidelines for the ED transfer fix. And I don't know if this is something that we want to spend a whole lot of time on. I just thought that I'll leave this slide up. This is, like I said, I have a couple of slides that I'm just kind of clicking through them right now so that you guys can see them. So you'll see there's one on catheters, impairments, immobilizations, respiratory support. All of this information obviously is familiar to you. This came out of the obstruction guidelines, the specs manual for ED transfer, for the ED transfer project that Stratus created. My only question right now is I'm going to just ask a couple of you, if you wouldn't mind answering. Do you guys have any questions about the abstraction guidelines? If not, like I said, if not, we can just skip right through this. I just put it out here in case there were some questions. So if nobody has any questions, oh, did somebody just, if you guys don't have any questions about the abstraction guidelines, I'll just skip right through them. Like I said, they're not as detailed as the specs manual for the CMS inpatient or outpatient core measures. They're pretty straightforward. But we have had some questions. So if later on, like I said, this is informal. If you do have a question that comes to you, we can always go back to it. That's not a problem. So with that being said, in the essence of time, there we go. Okay, so this. I'm going to see if my hands-free will work here better. This is where I'm going to show you how to use your reports. For example, like right now on the screen, you should see what your, the screenshot of what your ED transfer communication report should look like. I was going to provide a demo on how to generate this report for you guys to look at it, but obviously you have to do that every quarter and submit it to your Flex coordinator, so I'm pretty sure you are all very familiar with how to do this. So you'll just see right now it's a screenshot of what the report looks like. This report obviously is generated in the Excel data collection tool. And like I said, this screenshot is just the top portion of the report, and the next is this bottom portion of the report. So this is what I was talking about earlier. You will notice the ED Transfer 6 nurse-generated information I have kind of highlighted in red. And underneath it you have the 6 individual sub-measures, I guess, that impact the overall nurse-generated information. So I put little stars next to the ones because I went in and entered 5 mock patients into the ED Transfer data collection tool. And I wanted to show how you might be able to look at this on your end. If you guys go into your quarterly report in the ED Transfer Data Collection Tool, you run the report and you go to the section. I wonder if you can see my mouse. There we go. If you go to this section, I want you to check and see which one of these 1 through 6 submeasures is, I would say not up to par or not necessarily at 100%. But you can see here, for example, when I did my entry, I had catheters and oral restrictions. I'm at 20% on those 2 individual measures, and you will notice that overall for my ED Transfer 6, I am only at 20%. So I know now, looking at my individual facility report, what I need to focus on addressing. I know what my problem might be. Obviously, the reason why my ED Transfer 6 measures overall nurse-generated information is low performing at 20% is because 2 of the 6 submeasures I'm not doing so great at. So what I'm going to do is, as a facility, I would want to take this report and be like, okay, let's go back and do a few chart reviews and find out exactly what's going on. But in order to do that, we might want to go through the process of a PDSA. So before I move forward, does anybody have any questions on the report and how I'm interpreting that or interpreting that? Okay. So again, it'll vary by facility. You guys might go out here and run your report and see that, oh, you're doing 90 to 100% on all of them except for, oh, our nursing notes is at 60%, or hey, we're doing great on everything except for respiratory support. It's up to you to look at your individual report to see which one, or it might be more than one of these, is actually bringing down your overall ED Transfer 6 measure. So let me just bump to the next screen. One thing that I want to mention while this is loading is we do have a chat box open. Obviously, I'm sharing my desktop right now, but you still have the option to go to the ReadyTalk screen where this is can be full screen or not full screen. And you can actually, for those of you who don't necessarily like to talk on webinars or whatnot or chat, feel free to use the chat box to put in any questions. Or if after the fact, for those of you in Illinois or California or even Wyoming, if you guys have any questions about today's presentation, feel free to reach out, like I said, to your individual Flex coordinator. So again, that's Michelle Hoffman in Wyoming, Angie Charlotte in Illinois, and Jennifer Brooks in California. So if you don't feel comfortable answering questions on today's call or something comes up later on down the road, feel free to send those questions on to them and we will make sure we get back to you. Okay, so moving forward, we're going to use the PDSA cycle or PDCA, depending, like I said, where you went to school. It is by far my favorite little QI, rapid cycle improvement tool to use personally. For those of you who, if you have a different process that works for you, I encourage it. But again, I'm doing PDSA because to me it's very quick, straightforward. It's really easy when doing chart reviews or focusing or trying to pinpoint on a specific measure for improvement to just do rapid cycle improvement in terms of, hey, let's review. We just submitted our first quarter data. Let's go out and look at the report. Okay, where are we not doing so great? Let's do a PDSA on it. Let's try and implement some kind of quick change, and then next quarter when we submit, see where we're at. I just think that these work great for that. So for those of you who are not familiar with PDSAs, I'm just going to touch on it real fast. You should have a logo screen up on your computer right now. So the PDSA cycle is a method for rapidly testing a change. By planning it, trying it, observing the results, and acting on what is learned. This is a scientific method used for action-oriented learning. After changes are thoroughly tested, PDSA cycles can be used to implement or spread change. The key principle behind the PDSA cycle is to test on a small scale and test it quickly. Exactly why I was saying for rapid cycle improvement, it works by quarter to quarter or even month to month. I would actually encourage you to do month to month, but I know everybody is so busy and wears multiple hats that that's not always an option. But like I said, these work great for it. The PDSA philosophy is to design a small test with limited impact that can be conducted quickly, days if not hours, to work out any unanticipated bugs, I guess. So repeated rapid small tests and learnings, it builds a process ready for implementation that is far more likely to succeed by doing that, I guess, if that makes sense. So parts of the PDSA cycle, we're going to go over each one, and then we're going to dive into completing one. I'm going to show you the template, and I apologize, that was one handout that it dawned on me after the fact that we got you guys the slides, but I didn't get you the templates. So as a follow-up to today's webinar, when we send out the recording, we'll include those sample checklists and transfer forms and the PDSA template that I'm going to go over. So parts of the PDSA cycle, you have plan, which is up here in the top left-hand corner. In this phase, your objectives are defined and your team makes predictions about what will happen and why it will happen. Your team will answer some of the following questions, like what exactly will you do, who will carry out the plan, when will it take place, where, and what data information do you need to know whether there is an improvement or not. Then there's the do phase, which is at this stage, your team will carry out the plan and collect the data. This will include documenting experiences, problems, and surprises that occurred during the test cycle. Finally, you've got study or check. And then in this stage, your team will analyze the test cycle and reflect on what you have learned. You will compare results with the predictions made in the planning stage and draw conclusions based on the collected data. So this is where you would collect data again. So like the plan phase is like, hey, what are we going to do? How are we going to carry it out? When is it going to take place? Where and what data do we need? And then there's the do. This is where you actually carry out your plan. And then study is where you collect the data again. And then act. In this last phase, your team will decide if there are any refinements or modifications needed to the change you have tried. This may lead to additional test cycles, which starts the process all over again with plan. So you just keep repeating it until you have perfected, I guess, an individual measure or a process. So like the PDSA would be a perfect example of using it to test out like a current like ED transfer form you have or a current ED transfer checklist you have. So let me just move to the next slide, and this is where, oh, I went too fast. Bear with me, I'm going to escape out of the PowerPoint presentation. And everything that I kind of went through, because for me, I'm a visual learner and, well, hands-on too, but more so visual. Like when completing the PDSAs, even me and my background in knowing the PDSA like the back of my hand, it's still nice to have step-by-step instructions to walk you through, okay, like now what was I supposed to do or what questions am I supposed to answer? Because to me, when you're filling out the PDSA, I think it's helpful to know, okay, at which stage what the questions are. So for me, everything that I kind of just touched on for the PDSA on that last slide, I implemented a little cheat sheet here on the first. This is one of the documents that I'm going to share that just kind of has those questions that I talked about and a summary of what each stage is and a little bit of background. But anyways, so here we are, this is the template that we're going to fill out. What are we trying to accomplish? Well, here is where we would put in, and I'm trying to be mindful of the time. So here we're going to put in improve ED. Right here we're going to put in ED transfer communication. Sorry, my bad. My fingers don't want to work today. 6, which is the overall higher level, but we actually are going to dive down into that. Instead of ED transfer 6, we could put down improve the sub-measures, which, hold on, let's see if I can type this fast. Improve sub-measures for oral restrictions, I think was one. And I can't remember what the other one was. But you get the point. So here, this is where you will fill out what you want to accomplish. So when you use your first quarter report and you look at ED Transfer 6 and you see which of the sub-measures you might not be doing so great at, like for me I just put down oral restrictions, or if it's not necessarily that, if it's a different measure, this is where you would complete this information. So from this, then we're going to move from answering this question, you will develop your goal for improvement. So what this means then, we're going to move on to the second question. How will we know that a change is an improvement? And of course, by answering this question, we're going to develop measures to track the achievement of your goal. So how are we going to do this? Well, for example, let's see, if we went back and we reviewed the chart on, like let's say the 5 charts that I submitted for first quarter, and I looked at the ED measures, not the sub-measure of oral restrictions in each one of those charts, what would I find out? What am I going to notice? Well, let's say, for example, how am I going to know that it's changed? How about I identified that, I'm going to steal what that gal shared earlier. It's not on our transfer form, so it was a matter of documentation. And then what changes can we make that lead to improvement? Well, we're going to change and or modify our transfer form or our documentation to include that to make sure that it's getting documented. So you see, really, it can be it's specific to whatever is happening at your facility, and that's what these questions are aimed towards, is to try and help you figure out what it is. I mean, I know it's kind of hard right now in theory because it's not like I have any abstractions that I can pull up or mock medical records that I could pull up for you to look at that we can go through and actually do the PDSA live by pulling and identifying the charts and doing validation of the charts. I know it's more in theory right now, but that's what these templates are designed for, is to kind of help you come up with that information or identify that information. I'm just going to scroll down here real fast. So, oops. I'm going to try and get it all on the screen so that you guys can see it. Well, That's good enough. Okay, so here is where this is a template that you can complete for each PDSA cycle you undertake. So there might be more than one. Like for example, like if you noticed when I looked at my first quarter report, I had 2 submeasures that I wanted to look at. I would want to complete one for each submeasure. I wouldn't want to do them together because, for example, like oral restrictions and let's say I think the other one was catheters. There could be 2 different reasons as to why I'm not doing good on either of those. One could be that, hey, okay, the oral restrictions, it's not getting documented, it's not on the transfer form, or we're missing that component in the chart. That's why it's not getting completed. Versus with the catheters, it could just come down to it's getting documented, but we need to provide education better to the staff on how to better document it. Like, hey, we can see that it was done, but we're not seeing that it was shared with the receiving facility. There's no proof that that exists or that took place. So you want to do one for each individual submeasure, or you want to do one for each individual thing. You don't want to try and cluster them together because, like I just gave an example of, it could be completely different why one is bringing down the numbers versus the other one. And then who, what, when, where predictions and data to be collected. For example, like obviously these small little PDSAs are great for just you to do at first when you're trying as like the QI person or the person doing the QI activities to identify what exactly is going on, and then going from there is as far as to decide who, that depends on what you find out when you're reviewing the charts after you look at your data and see, okay, what measures are bringing us down, and then reviewing some charts to find out why that's happening. The who is up to you. You know, if it comes down to, hey, it's not getting documented, well then the who could be, hey, we need to talk to the nurse staff about how it's documented. Or if it's how it's being abstracted, it's just a misunderstanding of the interpretation of the abstraction guidelines, then it might just be like, hey, I need to talk to the person who's, you know, abstracting the data and reporting it. So the who depends solely on what you discover when you are pulling those few charts to find out what's happening with those components. And then plan executed, you're just going to document anything that might happen or any problems. For example, like I had mentioned earlier, one of the facilities for the EHR system that they had, they were running into problems with pulling the information out of their EHR. So that would be an unexpected problem or an event that you could document when doing that. That's just an example. And then the record, analyze, and reflect on the results. This just comes down to, I mean, you already have the system in place. It's not going to take any additional work on your end or planning on, I shouldn't say planning, but work on your end in terms of the report, because you have that system in place right now in the ED transfer data collection tool. It's quarterly, so obviously if you're going to want to look at it from a monthly standpoint, we'll have to kind of tweak how you go about doing that. But as far as the record and analyze, the recording is your ED transfer data collection tool. You're abstracting into that tool. You can review individual results. You can review your quarterly results. Everything's already built in. So I would just use your quarters going forward. Use your first quarter 2016 as your baseline, because that's the quarter you guys just submitted. And from there, I would review the report, see where you guys are at percentage-wise, then pull a random sample, I mean, depending on what your volume is, whether it's a random sample of 5 charts to see what is going on with, you know, what you identify, or if you only have 5 charts in a quarter, then, you know, pulling it and seeing what's going on, and then implementing something. So here, let me just, I'm trying to take consideration of the time, because I'm showing we have 19 minutes till. So I'm just going to minimize. Does anybody have any questions about the PDSA cycle? Again, this little 3-page document is going to get shared with the recording and the link. So obviously won't have all my typing in it. But what I wanted to do from here is jump out of the PDSA template, because what we'll do now is, let's say, again, this is theory, you identify a problem, you're filling out your PDSA template, you complete your PDSA template, you find out that it's a matter of your checklist or your transfer form. What I just wanted to show you is 3 of like the top checklists that have been used nationally, or identified, I should say, by Stratus through this project, and then also the transfer tools. So what I had done is taken screenshots of the checklist examples or the tools, but I'm kind of thinking they might not show up very well, so bear with me 1 second. Yeah, we'll try, and we'll see if you guys can see it. So real fast, like there's links inside this. So here are just the 3 that Stratus identified when they did the original pilot as a result of the pilot project for the ED transfer communication, and the reports that they got from the facilities and states that demonstrated in the pilot. They came up with some helpful tools that were implemented and or shared throughout that helped meet the emergency department transfer communication measures or components, I should say. But any of these checklists, because they're available via the web and have been shared as a part of this pilot, or the original pilot, I should say, they can be used, adapted, and to meet your needs. So if there is a checklist that you like, these have already been given the okay to, hey, use this checklist to modify and adapt to fit your individual needs. Or if you have any suggestions or feedback, just to share it. But let's see. So the first one is, and I don't know how well you guys can see this, is the transfer checklist, which I'm feeling this might not be. Can you guys see this okay? I wonder if I should bring up the live one. Can somebody just let me know if they see this or if it's all blurry?
You can see it good.
Yeah.
Okay, thank you. Thank you. I want to make sure you guys can see it. So this is just like one of the transfer checklists, for example, that was shared. And like I said, this can be modified to fit your individual needs. And they are in like Word documents. So it's not like it's in a PDF or anything like this. Like I said, you can completely manipulate them to fit your individual needs. And then let's see what the next one is. Here is another one. This is a checklist which just says, copies of documents that were sent with the resident, and then documents that are required to be sent. So send these documents if indicated. And then, again, it's a matter of you modifying and or changing this to fit your needs based on what you find out through your PDSA. If it is even your, implementing a checklist, that makes sure that all the information is being sent, or if it is updating your transfer form to make sure that everything was included and sent off. Let's see here.
Shanelle, this is
and
Michelle.
all of the, yeah.
So you have another 15 minutes. We extended it for 15 minutes, so you have until, you have another half hour, just so you know.
Wait, say that again. I'm sorry.
This was supposed to end in 15 minutes, but we've added another 15 minutes on, so you do have like a half hour.
Oh, okay. Thank you.
So
I'm
aware.
sorry. Okay. Thank you for that. For some reason, like just the top of the hour was stuck in my head, and I did not want to have to run over, and I didn't want people to have to jump off early. So thank you.
No, you're good.
That makes me feel a little bit better. So. Okay, so I'm going to go back here a little bit. Does anybody have anything that they want to talk about and or share when it comes to checklists? Have any of you actually used any of these tools that are out there as part of the project, or have you found just using the guidelines to adapt your own transfer tools and checklists has been more helpful than these? Or have any of you on the call used any of these resources and tools that were shared by Stratus for part of this project, any of the checklists or the transfer sheets, I mean? Wow, we have a really quiet group. Okay, so I'm going to keep going then, but this would be a great, and if I could pull it up. Oh, yeah, it's not going to let me. Okay, but so the whole purpose of today is trying to get you guys familiar with running your ED transfer report, identifying what in the report is dragging your overall numbers down, then using that information to complete a PDSA, and then implementing a quick change, whether you do identify that, hey, if we implement a checklist, it's going to make our numbers go up, or hey, when you're pulling those records to see what's going on, finding out, is it just a matter of educating the staff on how to better document, or that the information was sent, and so on and so forth. But anyways, these are just some sample tools and resources that can help fix some of the common issues, because one of the things that I've noticed when we, at least with working with the facilities in Wyoming, is that some of these tools are helpful because they didn't necessarily have a checklist, but they had a transfer form. Or they had a transfer form, but because of ED transfer being new, they actually used the results to better their transfer form in their EHR system to ensure that the stuff was getting sent and ensure that it was getting documented, but then also that the staff knew how to pull the information and actually collect it so that they were getting credit for doing it, I guess, so to say, but then also knowing that it was done. Let me move on. So, okay, so we went over that last checklist. Here's another checklist. And I'm sure a lot of you are familiar with the stuff that's on here. You got the face sheet, the transfer form, current list of medications. I'm sure a lot of you are familiar with SBAR. Let's see here, pulse, advanced care orders, H&P, discharge summary, special orders. So essentially, like, all the stuff that's on here is really the same information that you would see in the abstraction guidelines on when it talks about suggested resources on where to find the information within the chart. I don't know if you guys have noticed that on the abstraction guidelines. There's the inclusion, exclusion criteria, the measure definition, but then it also talks about possible locations on where to find that information. That's how they generated these checklists. Let's see. Transfer forms. This is just, let me move. If you were to create your own sample transfer form, and again, some people like to create their own, some don't like to reinvent the wheel, so they like to use existing ones that are out there. This slide right here is just more so FYI to you in terms of if you are going to create your own transfer form for your facility, if you don't already have one, but which I'm sure a majority of you do, but just some things to keep in mind on what you have to have. Like, I do know that each state is different, and there are minimum standards that have been set, especially with the care transitions and or transfers. So this slide just gives you examples of what is required within the standard data sets established for all care transitions. So it's not just specific to, ED transfer 6 per se within, like the oral restrictions, the immobilizations, the catheters, and so on and so forth. This is like overall. So I just thought that would be helpful, to something to keep in the back of your mind if you are going to create your own transfer form and or update your existing one. There are some requirements or standards, I shouldn't say requirements. So again, sample transfer forms, this is where I think I have them screenshotted again. So here there were 4. Let's see, I'm trying to think of which one. The safer handoff ones are really great. If I don't know how familiar all of you are with the safer handoff, it's like a care transition initiative that took place. But let's see here. I think okay, yep, the screenshots I could not take. So bear with me real fast, like, while I actually bring those up for you to see. It's going to let me. There we go. Bear with me one second. While I'm pulling up these transfer forms, the line's unmuted. Does anybody have any tools that they have found other than maybe like a checklist or a transfer form, or maybe you have found a transfer form or a checklist outside of the ones that we're sharing today or that we're showing you, that you would like to share with the group? It doesn't necessarily have to be one of these tools, but is there anything out there that you found when participating in this project that helped you either with abstraction or collection or improvement?
This is Ann from Wheatland, Wyoming, and actually our EHR has a fantastic transfer form, and what I found was that the most of it was just documentation, that people were just forgetting to document what they had sent, and it was all sent. It was I'm sure it was all sent, but it's just not documented. It's the only thing we've found.
Oh, okay. So I have a question for you on that note. When you say you guys have a great transfer form in your EHR, like was that part of a surface, and this is, maybe this will help other people on the call, but also just for me, did your EHR vendor, is that something that they developed and created that was just available through them for you to use? Or was it something that you had to work with your vendor and your IT staff on creating within your EHR so that you guys had it available?
I really don't know. It's been on our EHR for a long time. It's been a part of it since the original design and then tweaked over the years. But clearly somebody has had some of this input into it, because it truly, whenever you look at the EDTC requirements, why it's all on the transfer form, and it's just a matter of people checking what was sent.
Wonderful. So when
Hi, this is Claudia. I'm part of the same system that Ann is in. We're part of Banner, which is a large corporate system of hospitals, and we all use the Cerner EHR tool. Cerner is a best practice recognized EHR system, and in combination with Banner system that we belong to, we do have large teams that look at, from a best practice standpoint, at the product or the end product that we use. So that's how we have that transfer checklist in our EHR.
That's awesome. So if somebody's like consistently like looking at it and are modifying it, let's say like if the abstraction guidelines changed or a new measure was added or something like that, and your form needed to be updated, is there like through the Banner system or through just as part of a satellite facility, do you guys do like training with staff to say, hey, FYI, this form that you guys have been using for the last 5 years, we added an additional box because this new measure is a requirement, so just make sure you check this box. Is there like education that's done widespread through like the Banner system that like, hey, we made changes to this form, or is it done individually at the facility level?
Yes, we're always notified of updates and changes. We get emails to that effect. All of our senior nurse managers, leaders in our departments are all made aware of the changes, and then the expectation is the trickle-down effect through staff meetings and through our nurse educators to update all staff on changes.
Oh, that's
and we
awesome.
also do have a clinical informatics person stationed at almost every facility to be able to highlight the significant changes as well.
Wonderful. Thank you so much for sharing, ladies. It's much appreciated. Does anybody else have anything that they want to share in terms of the system that they use and how their transfer form might be built in, or checklists, or any other type of resource or tool that you're using to make your life easier with the ED transfer data collection and reporting? Okay. Well, okay, so we're going to move on. So I'm just going to quickly bring up these transfer forms. I did notice that I spoke incorrectly earlier. I noticed the checklist that I had shared with you. Those were in Word, but I'm noticing actually these transfer forms, it looks like some of them are in PDFs, and I don't know if that had something to do with me downloading them to be a PDF, but I'm almost positive all of these can be modified. So I just wanted to show you here, this is the safer handoff one. This is one of the ones that was popular during the pilot that facilities were kind of adapting and or stealing from to update their current transfer form. But I'm just going to scroll down and show you this real fast. Like, I was hoping that there might be a couple more facilities that would want to share what they're currently using. One thing that I want to mention, and now might be a good time, there is a listserv that in Wyoming, for example, we are developed for ED transfer communication that I just wanted to share with the group. And this might be a better means of getting like tools and resources from that that facilities can share with one another, whether it's a transfer form or a checklist or a, one-page like cheat sheet or how-to guide or whatever it might be related to the ED transfer, or even like, hey, this is, instead of the PDSA template that Shanelle shared, here's our PDSA template that we like, that it might be more user-friendly for you or something. I'm hoping that maybe throughout the course of these webinar series over the next month, and with that listserv up and running, it will be a great network for the facilities to be able to share tools and resources and common questions. And of course, I'm sorry I said that for Wyoming, but obviously that would be a great way for us to still be able to share stuff that is continuing with this webinar series with the other states so that it gets shared as well. The one thing like I said, on the next couple of, sorry, I'm trying to talk and bring things up, which is not working. I'm just going to show you another tool. This one's a little bit more busier, little bit busier. It's only one page. I haven't had a chance to actually go over this one and compare it with actual abstraction guidelines and or like I have with the SAFER checklist, because we actually used that one in the past, which now I'm sorry. Oh, I'm not paying attention. Anyway, so these are, like I said, these are available. These are links in the PowerPoint themselves that were sent to you in the PDF. It's just a matter of, I think it's hitting Control and then clicking on the word, and it will actually take you out to these tools on the web. Let's see, I think there was one more that I actually wanted to show you that I really, really liked, but I'm seeing that. One of the things that I was hoping to do, which obviously these are not with the transfer forms we can't do, but use those PDSAs. And when you're actually, if you were going to, for example, if you were going to implement like a new transfer form, one thing I just wanted to mention that we did in one facility and it worked out really great, is when you're pulling those, let's say 5 charts for validation, you're looking at your first quarter, you're like, okay, this oral restriction is bringing our ED transfer 6 down. How are we going to do this? So let's go back and pull those 5 charts, find out where we went wrong. If the transfer form is something you're going to do, one thing that I had a facility do once is before they implemented a transfer form, they actually took a blank one, like let's say this one that's up on your screen, and they sat down next to their one of their charts or the 5 charts that they pulled, and they actually redid like a kind of like a checklist abstraction where they went through the chart and completed the transfer form, just like a mock transfer form based on that chart or that ED transfer, I should say, abstraction, to see if it was easy for them to fill out, if they were struggling finding stuff on the form, that type of thing. I know that's paper version, but that was something that they did before they implemented it electronically, and they dealt with their IT department and or their EHR vendor to actually get it programmed in, because it was easier for them to do. And again, it was a small PDSA. They were like, okay, hey, we have problems with our transfer form. Hey, we found like 3 that we want to try out, and the group decided that this is the first one we're going to try out. Then you sit down and you actually abstract your transfers using this transfer form, for example, and then say, okay, hey, what did we have problems with? What did we like about the transfer form? What did we not like about the transfer form? Did we have a hard time finding certain components to make sure that they were sent off? Then once they have it tweaked and or modified to fit their needs, like whether it's moving certain things around or adding things or rewording something so it makes sense for the staff at your facility, then they met with IT and EHR and they're like, hey, this is the form that we want to use, and these are our suggested changes, so that it's not one of those things where you're consistently going back and meeting with IT or your EHR vendor and constantly having to reprogram the report. It's just, it eliminates a lot of processes. And again, it's another perfect example of how you can use the PDSA template to toward anything, whether it's, okay, we have a checklist we want to implement and see how it works. We have a transfer form we want to implement and see how it works. Or we have a transfer form but we want to add a couple new components to it. The PDSA is a great way to check every single thing that I'm mentioning right now, whether it's a new form or an update to a form and all of that. It is just a great way to do, like I said, rapid cycle improvement and monitor what it is that you're doing. You, again, would just answer those simple questions throughout the PDSA template itself. Does anybody have any questions about the transfer forms that I both pulled up, or the checklist, or just in general anything on the anything at all on the presentation itself, whether it's the PDSA template or the actual data that we went over earlier? No? Well, I don't think we have enough time to, I'm showing 4 minutes after 12. I don't think we have enough time left on the clock to actually go over developing and implementing an action plan. I just think it would be too much in too little of amount of time, and I don't know if we could effectively talk about implementing a developing an action plan and actually implementing it. I think we can save that for the next ED transfer measure. Let's see. Let me go through here, and then let's see here for a second. Bear with me one quick second. Yeah, we're going to skip the action plan thing. There are some few miscellaneous reminders I want to talk about. Let's bring up this side, and then we'll open it up. But some miscellaneous reminders for all of those of you who are still on. The second quarter 2006 ED transfer data collection submission deadline is July 31st. So that's the next data submission deadline. So you can see where it being, the middle of May, it would be a perfect time actually to try out the PDSA and review your first quarter data and see if you can't identify where a measure you might be falling short. The other thing, and I realize that some of this is specific to Wyoming, but the ED transfer data submission deadline for second quarter, that applies to everybody. The deadline is July 31st. Check out our new website, the Quality Improvement Matters website. It was developed for the Wyoming Critical Access Hospitals, but I'm sure we're open to any facilities going out there and checking it out. It has all the MBQuip tools and resources out there, ED transfer tools and resources, some great quality improvement and data collection guides and quality improvement toolkits, I should say. For Wyoming specifically, we have a Quality Improvement Matters newsletter that's going to be going out on the 17th. For any of you on the call who use the CART application, known as the CMS Abstraction and Reporting Tool, just a friendly reminder that the upgrade or update to that is now available. So in order for you to get your fourth quarter 2015 discharges or encounters in, you have to get your CART upgrade done. Otherwise, you won't be able to import, abstract that quarter worth of cases. This new release was done back in March. Then they released a patch. But long story short, the new release does include the new ICD-10 codes, and it is required for fourth quarter submission, which outpatient has been bumped to June 1st and inpatient being due May 15th. A couple of things, and I don't know, I hope I get these dates right. I mentioned upcoming 3-state webinars. There is one May 24th that is going to be on OP27, which is the healthcare influenza personnel vaccination, and IMM2, which is the influenza measure. And then I believe we're going to have the remaining webinar series of ED transfer. It looks like it's going to be every other Thursday. So correct me if I'm wrong on these dates. I just jotted down. I believe the next ones are going to be, is it the 26th, 16th, and 23rd, Michelle?
Let's see.
I know it was 16th and 23rd, I thought, of June, but I couldn't remember if there was one on the 26th.
I believe so.
I was trying to bring up my calendar and it wouldn't let me. But anyways, just stay tuned for that. I just wanted to let you guys know that there are more upcoming webinars on all MB, not all, but a majority of the MB-Equip topics. And then also for the next ED transfer webinar, there are actually going to be, like I said, high performers from additional states that are going to be sharing what they specifically did on the next measure, whether it's 4 or 5. And exactly like I'm going to have another one actually share a tool that they have used or are using. So there will be more high performance sharing on the next ED transfer call. Today's call, we had a high performer, but it was more so just the sharing of stuff that they already did. They weren't available to actually talk on today's call. That's why I was sharing just the EHR thing that they had done with the PDSA. So if there are any questions, we can have them open at time. We have a few minutes. If not, then I guess we'll be ending early. Michelle or Rochelle, does anybody have anything to add? Or does anybody have any questions?
This is Rochelle, and I'll just, I believe the dates are May 12th is measure number 6, or that's actually today. June 16th is the next one for measure number 4. June 30th is measure number 5, and then July 14th is measure number 1.
Awesome. Okay, 14th. That's the one that I didn't have down. Okay, awesome.
And then the 24th of this month for the IMM. No, yeah. For IMM2 and
OP27.
27. Yep.
All right. Okay. Well, like I said, with that being said, I'm actually going to stop the recording then. And the recording and everything will be sent out along with the templates that I had went over today, the PDSA template, as well as we'll just include the links again for those checklists and or forms, or actually just attach them because the links are in the PowerPoint themselves.